What's going on YouTube? This is Dr. Alex Tubio. Thank you guys for tuning on in again. Before we get started, if you could like, comment, and subscribe, I would appreciate it. So today we are doing an adjustment, a full adjustment and a full workup on my patient Elias. And exhale out. He came through me through Instagram, messaged me, contacted me. He's a hairdresser having a lot of numbness, tingling, headaches, radiating pain down the arms, low back pain. So if that's resonating with any of you guys that are watching this, make sure you guys listen to everything, see everything. This is gonna really help you. All right, so let's get to the video. So just go through a little bit about what you're basically saying beforehand, how it actually came about and everything.
Okay, so I'm a hairdresser, so basically the constant use of me round brushing and the whole way I do my styling procedures are gonna be me with my hands up. So I'm thinking that my shoulders and neck are due to some of that. Yeah. But I also had an accident in June, so I think that intensified the pain even more. I get massages and I kind of get adjustments, but it's more of like an adjustment that's in and out kind of thing, and it's a more fast kind of process. It's not like actually a chiropractic office. Okay. So where do you usually go? The joint chiropractic. Okay. So it's in and out. They adjust me and it's cool. But when I reached out to you, you told me, you know, what your fee was and what came with it. And when you were like, I want to do an X-ray to see what kind of, if you have any issues, deal with those. Kind of sold me right away because I was like, you know, I really have never had that experience or that told to me through a chiropractic part. Okay. So,
the reason why we take x-rays is because there's a certain way that your body's supposed to be. You want this to go like this, and like this, and it's supposed to be straight. Whenever it is straight up and down and you have those curves, that's when your body's really functioning at its full potential. Meaning that that's when you don't have any of the pains, that's when you don't have any of the symptoms, in theory, right? So that's what we want to always try to get that ideal to, is those structures. Whenever you do things such as hair, and I have a lot of hairdressers that do come in as patients, and they're also barbers, and I know a lot of them are always like this, right? When you're like this, your shoulders are elevated, your traps are elevated, and a lot of times you're mostly looking down instead of up because you're never really going to be cutting hair up this way. So when you're looking down like this, that curve that's supposed to be in your neck relaxes, meaning that it loosens, and then after it loosens like this and it keeps that curve going this way, it tightens up. Once it tightens up and you lose that curve of your neck, that's when you start to feel a lot of cascade of that problem. So the neck tension, the shoulder tension, do you have any headaches or migraines or anything like that?
I've had some. I really had never really had headaches besides, you know, if I'm feeling ill or whatever. Yeah. But recently I've had more than usual, like tightness, just around my jawline, you know, and I'm thinking it's coming from that because I don't really feel that I have anything else that I have to worry about. So I'm thinking it's the stress that I have on my neck and my shoulders is tightening up so much here that is giving me that just a little bit of a headache, like a lot more often than I ever had before. Right.
I give this analogy. It's like a fishing pole, right? So if you had a fish and it's a strong fish and it's going right through the water, right? And you're trying to reel it back in. You still following me? So think of that fish as your head, right? So if you're like this and you're pushing out this way, all of those muscles that are in from your neck going down into your shoulders are attached to these bones, right? So when it's attached to these bones, it's being stretched out, and it's being stretched out more and more and more and more. As it starts to stretch out more, then your body's trying to pull it back. Right. The reason why it's pulling it back is because if you were to be like this and leaning forward that whole time, you can imagine that it would be pretty hard for your body to, or just you in general, if you had to hold something out like this, it'd be really hard for your body to hold it. It'd be really hard for you to hold whatever weight that was. So in order to really relax that tension, right, would be to what? Catch that fish, right? Bring all that tension backwards. That's why we focus on the curves here, is because with that curvature in your body, in your neck, you're able to take this curve that's moving forward and pull it back up this way. That's why whenever you get the massages, whenever you get even sometimes the adjustments as well too, so you might feel pretty good after the adjustment, right? Or after the massage. But even after the massage for say maybe a couple days later, you feel the same thing again.
Typically,
Right.
yeah. I go get the massage or get the adjustment, and then for that day, it's kind of like, okay, I feel better.
Right.
If it's a massage, the next day, 2 days, it's like I'm a little sore, but I'm used to that because I get massages.
Yeah.
Try to get massages regularly. So I have that soreness. I'm like, it's gonna feel better. By the 4th, 5th day, it's like I'm starting to feel it again.
Right.
I know it also might be because I try to sleep on my back. It's really hard for me to stay on my back.
Yeah.
And I always end up turning to my stomach, and I'm on my stomach.
And your head.
And I'm turned, I'm turned this way or turned that way. I mean, it's like
you're just tossing and turning like a whale, right?
Yeah, and now it's like I don't have a really good consistent sleep because of the issues with my neck. Yeah, like it really doesn't let me relax.
Yeah.
And when I wake up in the morning, it's really stiff. Like
Yeah.
I just have to really stretch a lot, and in the shower, just try to hit warm water on there, and it kind of helps me relax a little bit. But it's not something that's really going away. I feel like it's little by little, it's getting worse.
Right. You're starting to have more headaches now, right?
Yeah.
How many headaches would you say you're having per month?
Maybe like 4.
4.
Probably.
So basically like once a week then?
Kind of once a week.
Okay. Can you describe the pain in your neck for me? Is it a sharp pain, a shooting pain, a stabbing pain?
I think it's a little bit of mixture of all of that.
All of it?
Yeah, like sometimes it's like, oh, I feel fine. Like it feels okay. But then I turn a certain way, or if I was like, oh, I remember, you know, my neck's hurting, let me see if it's okay. And I kind of just turn a little bit. It's like I can feel it like just a sharp pain like in here.
Okay.
If I'm sitting still, not really doing much, I kind of tend to forget a little bit for a little bit. But if I have to turn or if I have to do something, it'll come back a little bit. It starts as a dullness or the sharpness. It just depends on what I'm doing.
Okay. And you said it does radiate into your fingers sometimes?
Yeah, yeah, it definitely does radiate from here, and it comes my shoulder. I'm always constantly just, you know, moving, stretching, trying to. I mean, I try. I don't know how good it is to be popping your elbows and your, but I've done that since I was young. My goal is to get some kind of relief from it. It's affecting my sleep. Like I wake up several times at night just because I could feel it, and then I don't know if it's just me always constantly thinking about it. Yeah. That it doesn't let me just relax and just be like, okay, just calm down. You're supposed to be sleeping. Right. But I think I want some kind of feeling like I'm getting some kind of result. Right.
What we're going to do now is take the x-rays. That way you're not just coming in sporadically.
Okay.
All right. Sound good to you?
Yeah.
In normal, right, you have this 43-degree curve. So this curve has to be at 43 degrees. Just like this, all right? Okay. So this is normal. Whenever I bring up your x-ray, you're gonna let me know what phase you think you're in. You ready?
Yeah.
Does that look anything like normal?
No, not at all.
Not at all.
I can see where you're pointing, where it's getting closer like that, and pushing together.
Yeah. It's getting closer and closer and closer together. This is almost it's like a spitting image of phase 3. Yeah. Right.
Like literally right now, I can feel like tingling.
You can feel it, right? And then the actual curve of your neck is a negative 20 out of 43, which is 147% loss of your curve. The reason why you're getting the massages and all the adjustments and they're helping for a little bit, but then they come back is because of this. Yeah. It's pretty real when you see it, huh?
Yeah, it's crazy.
But that's why we take the x-rays, man.
Yeah. That's what won me when you said I need to do this, this, and this, and this. I never had a chiropractor tell me I need an x-ray. And seeing it, it's more like...
And you see why you want to see the x-ray, why we need the x-ray, how vital and how important it is to get that x-ray. Man, I remember being in a position like you're in, right? We're not too far off in age. And remember thinking, like, man, I don't know what's going on with me. I don't know why. What I'm doing isn't working. Adjustments are supposed to work. The massage is supposed to work, but it's not. And until I saw this x-ray, I was like, holy shit, you know, that's it. That's it right there. That's why I'm having this stuff. And once it's more real to you, right, and you see it physically, right? It's not just somebody saying there's something wrong with you. You're seeing it exactly the way this looks like compared to what normal looks like. It doesn't look anything alike. Now you can actually take that and be like, okay, I gotta get this fixed.
Yeah. I'm ready. I mean, I want to feel better.
This is just a sum of everything that you've been through in your life.
Yeah.
Right. And now it's just presenting itself in this way. That's why it's so important for spinal care, for spinal hygiene, to make sure that you're taking care of your spine day in and day out. There's a correlation between everything.
Yeah.
All right. All right. So let's get you adjusted today.
Yeah.
And then we'll reschedule to come back in.
All right. Cool.
So I'm going to have you go face down here for me. All right. It's really tight up through here. Do you have any radiating pain down your legs or anything like that too?
Not really down my legs.
No.
Mostly the majority is in my arm.
Okay. So you see this portion right here, right? I'm feeling it right here.
Mm-hmm.
This is your thoracic region, and though there should be a curve, we call it a kyphotic curve, this one is just extending a lot further out than it needs to be, but it's also because of how far this is moved forward. So what I'm going to use here first is an arthrostim. All right. This is an arthrostim. What it's going to do is help relax some of the muscles in through your face. I'm going to work my way up, giving a little bit more movement. And that's the thing, the adjustments don't ever take too long, right? It's all about the intention of the adjustment. It's all about what you know previous to the adjustment. That's, you know, our adjustments here don't take very long either, but it's not in the same respect, right?
Yeah.
Because we'll see we already know what your exercises look like. We're hitting those points consistently. Because to move a curve like that, it takes consistency. That's really what it really takes. So what I'm going to do, I'm going to start at the bottom and then work my way up, okay?
Okay.
So this table will pop up underneath of you here. And I'm going to be pressing down into that circle. Remember how I was telling you it was just a little too far popped up? I'm going to press down right here. Good. Any pain when I do that?
No.
Good. We're going to do the same thing right through here. Good. Good. And then one more right here, a little bit lower. Good. So I'm going to go right into this region right here. Good. Good. Felt a little give there. I'm going to have you look up a little bit. Good. And then scoot down towards your feet a little bit. So I'm going to bring this up just like this. I know that's a little uncomfortable, right? But what I'm doing is helping this remember what type of motion it's supposed to be in or where it's supposed to be positionally in your body. This chest piece is going to come up. I'm going to adjust you real lightly in through here first. Good. Any pain when I do that? Good. Go again right in through here. Good. Did you feel that there? Yeah. A little bit more up here. Good. And one down here. So this is just breaking up. Now, this headpiece is going to pop up underneath of you. I'm going to be pressing right where that C5, C6 region is, right where it's starting to close up, and I'm going to start to open it back the opposite way. Okay? So this is going to come up just like this. It's a little loose. Might be a little weird. Take a deep breath in and exhale out. Good, right here. Good. Do it 2 more times, okay? Deep breath in and exhale out. Good, right here. Good. And one more time here and exhale out. Good. Good. That feel okay?
Yeah.
All right. So I'm going to adjust this mid back right here. I'm going to have you take a deep breath in for me and exhale out. Good. Good. How'd that feel?
Good.
I'm going to adjust this lower spine right here. Take a deep breath in right here. Exhale all the way out. Good. Right there. Awesome. Good. And I want to release this even more so. I'm going to pull your head. Sorry if I have to mess up your hair here. I imagine you know how to do it pretty well, so just relax a little bit more. Take a deep breath in. Exhale out. Good, right there. Good. Good. All right, go on your back now for me. So we're gonna adjust your neck. I'm going to keep hitting those regions.
Okay.
So first I'm gonna hit the C5 region right here. Ken, you wanna come around this way? I'm gonna hit right, feel that right there? I'm gonna press right in through here. Now, I'm gonna have you relax. Does that hurt a little bit?
Yeah.
All right, just relax. You're gonna give your body just a little bit more. You're okay?
Mm-hmm.
All right, take a deep breath in again. Tilt your chin up a little bit more. And exhale out. Good, relax. Awesome right here. Good. And then we're gonna go on the opposite side now. Come back here. Take a deep breath in. Exhale out. Good right here. Good. You okay?
Yeah. I felt it.
Yeah, that was a big one. So now I'm gonna distract this joint right here. I'm going to open this. You can feel that opening, right? Does that hurt a little bit?
Just like a little pinch.
Okay.
And it's on like on this side.
So when I open it like this, does it help it a little bit?
It helps, yeah.
Yeah. I'm going to pull a little bit, okay?
Mm-hmm.
Deep breath in. Exhale out. Good. Relax your shoulders there for a minute. Awesome. Do you feel that one?
Mm-hmm. Yeah.
That was big. That was right.
Yeah.
Right at that region.
Yeah. Like literally when you were adjusting, I could feel so much tingling in my arm, and now it's like I could feel it like just like
Relief.
it's weird. Like it's like feels warm. Like,
Yeah.
I don't know. It's weird.
No, that's awesome. All right, go ahead and sit up now for me. Face that way. So the next thing we're going to do is we're just going to use this arthro stim right here at this region, and I'm going to have you look all the way up. Good. All right. That last one was so needed.
Yeah.
It just
Yeah.
right there.
It was crazy because I'm telling you, this side has been killing me, and when you did a certain adjustment, I just could feel this tingling, and then now it's like it feels weird.
It's like it's relearning like what that nerve path was, right?
Yeah. It's weird. It literally felt like little tingles all the way down, like that, just like shocking tingles, and then not a hurt. It was just tingling, and then that last one, it was different. It was crazy.
It was awesome.
Yeah, it was weird. Yeah, it was weird.
All right. Well, that's it for today, man.
Okay.
All right.
Yeah.
And then we'll have you come back. We'll go over everything.
Okay.
All right.
Yeah.
All right.
I'm ready.
I'm ready for you, man.
I
It's
need
gonna be
to-
good. Yeah.
To get back to normal.
Yeah. All right. And then one more right below. Good, right here. Do two more. Good, right here. Good, one more time here, and take a deep breath in right here. Exhale all the way out. Awesome. Good. And exhale out. Good. Good. Relax. Awesome right here. Good. Good. Exhale out. Good. Relax your shoulders there for a minute. Awesome.